This video is my attempt to overview the muscles on the skinned frog. What you're looking at is actually a diagram that one of my former students constructed. You can see her name, Audrey, in the corner. And following the frog dissection, this is not a true dissection because we're not looking at internal organs, we're only looking at musculature. She took the liberty to redraw or recreate the anterior view, the ventral view, this is the stomach of the frog, and the posterior or dorsal view. And then I took a Sharpie and drew in the major muscle groups and have labeled them A through I. So I just want to quickly walk through this diagram with you, and then we're going to label the muscle groups on the actual frog. So this muscle group A represents the pectoralis major, B represents the biceps brachii, C represents the rectus abdominis, D represents the hamstring group, E is the trapezius, F is the latissimus dorsi, G are the external obliques, K is the triceps brachii, J is the quadricep muscle group, H is the gastrocnemius, I is the Achilles tendon, which anchors the gastrocnemius to the calcaneus, which is the heel bone. So I have a frog that I have skinned. The skin is completely gone except for the face and the hands. And we'll do the anterior muscle groups first. Unfortunately, the frog is not in anatomical position. This happens, so we're just going to have to make our way through the major muscle groups. And I will try to attempt to hold the frog close to the camera so that you can actually see the definition of the individual muscle groups. So I'm going to start with pectoralis major, and again, this is the anterior view of the frog, or the ventral view. So this is the frog's belly, and this is very similar to where this particular muscle group would be on us. So the pectoralis major is a major chest muscle. If we were doing a lot of push-ups, then the pectoralis major would get bigger. The biceps brachii are hard to identify in the frog. So can you see this muscle group right here? This is the biceps brachii, and of course my tags are going to get in the way. All right, biceps brachii in the arm. Then we have the rectus, oops, there goes my tag. So remember, the rectus abdominis has the linea alba. It has the line going down the middle of it, and you can see how transparent that tissue is. How you can see the fascia, this shiny layer right here, that's all fascia, and you can see that transparent line going right down the center of the rectus abdominis, and why that would be such an ideal spot to make an incision. And the rectus abdominis has 6 or 8 pockets of muscle, which is why it's sometimes referred to as the six-pack. So there's rectus abdominis. And moving down to the leg here, if you can find the knee of the frog, okay? Now in humans, the knee would be in front, but on the frog, the knee is facing lateral. So find the knee, and then all the muscles above the knee, all the muscles superior to the knee are members of the quadriceps group. And remember the quadriceps group, so here's my tag. The quadriceps group includes the vastus muscles, the vastus lateralis, the vastus medialis, and the vastus intermedius. And then underneath, or I'm sorry, on top, right where I've stuck that pin, is the rectus femoris. Then we have the kneecap, probably tibialis anterior right here. I have not made a tag for it. And I'm going to turn the frog over and label some muscles on the back. So you might have to use your imagination a little bit, but there is a muscle group on us that is very defined in terms of its shape, and that is the trapezius. All right, so I'm kind of outlining it here with my utensil. But what I want you to notice is the contrast in both color and shape of this muscle right here. It kind of looks like the Nike symbol. So it's a darker yellow. It's right underneath the trapezius. And in us and on the frog, it would be inserting right into the armpit. So this is the latissimus dorsi, and here it is over here, the latissimus dorsi. And so the trapezius is above it, right here. Trapezius, and then latissimus dorsi are these two pockets right here. So I'm going to label my trapezius and my latissimus dorsi. I probably should have made a tag for the erector spinae. In us, that's a muscle group antagonist to the rectus abdominis. It is deep in us. Here it is on the frog. I'm also going to label the external obliques, this puffy muscle on the side, which assists in coughing and sneezing and defecating. I also want to go ahead and label the triceps brachii on the back of the arm. So if I can find the elbow of the frog, everything superior to the elbow would be triceps brachii. Okay, that's just 3 more to go now. So again, on the leg, everything superior to the knee was the quadriceps group. So that means that behind the quadriceps group, on the opposite side of the leg, is my hamstring group. And the hamstring group includes the semitendinosus and semimembranosus, as well as the biceps femoris in that hamstring group. Moving down to the calf muscle is called the gastrocnemius. And then the gastrocnemius inserts, there's a tendon here. Can you see that tendon? That is the Achilles tendon, which anchors into the heel, the calcaneus. All right. So again, on the front of the frog, we labeled the pectoralis major. Pectoralis major. I'm going to take these out now. We labeled the biceps brachii in the arm. We labeled the rectus abdominis in the core and the linea alba. We labeled the quadriceps group in the thigh, including the rectus femoris and the vastus muscles. On the back of the frog, we labeled the trapezius, which is behind the eyeballs. In us, that would extend our neck. The latissimus dorsi, which is the darker yellow band that inserts into the armpit, latissimus dorsi. External obliques along the side of the torso. Triceps brachii behind the arm, superior to the elbow. Triceps. And then finishing off in the leg, the muscle group behind the quads on the posterior side are the hamstring group, including the biceps femoris and the semimembranosus and semitendinosus. The calf muscle is the gastrocnemius and the Achilles tendon.